Listens Live.
And it is a celebration.
With your host, Jon Ramsey.
Welcome into the Wednesday edition of Wave 3 Listens Live. You know, one of the best compliments anyone can receive, if someone says, wow, you have a beautiful smile. Doesn't that feel nice? Because I think we all associate a smile with joy, with happiness. But what if you're not happy with your smile? What if you have ill-fitting dentures and you're always covering up your mouth, or you don't like getting into pictures with a family, and you're missing a lot of really social time, good, valuable memories? Let's talk about that with Freedom Mini Dental Implants. Dr. Regan Ackerman rejoins me once again. And Dr. Ackerman, I know it's much more than that, but there is a lot to be said for feeling confident about your smile, for feeling good about it. It exudes confidence. It helps you in so many areas of your life, right?
For sure. I mean, in our jobs, in our daily lives, around our family members. I've had patients tell me, people thought I was a mean person before because I never smiled, but I was afraid to smile, or I was afraid my denture was going to fall out, or I just stayed home because I didn't want to wear my dentures. And it takes a toll on people socially and mentally, for sure. So that's what we're able to do with the mini dental implants. We do denture, what we call denture stabilization, where that denture can snap onto those implants, so you don't have to use glue anymore. Your denture will stay in. You can chew better. We can get rid of the denture altogether with the permanent teeth. So I hope people get their smile back, every day, and it's so rewarding.
And I know, Dr. Ackerman, this technology is not new. However, admittedly, I didn't know anything about it until Freedom Mini Dental Implants started coming on the air and telling me exactly what it was all about and how it works. And I think there may be a lot of folks who do not realize that, hey, this technology's been around for 15, 20 years, right in that zone, but if you haven't been to the dentist in a while, if you haven't examined getting rid of your dentures, wouldn't that be nice? And now you can do that, can't you?
Yes, and I hear that so often, people, and that's why I do, shows like this to spread the word, because people don't know about it. Like you said, the mini implants have been around for, 15 plus years. But like you said, if you have dentures, you really haven't been to your dentist. You don't know that this is an option. And even a lot of general dentists don't know this is an option. I went to a lot of, extending and continuing education courses to learn about this, and I found out it was an option. And that's when I fell in love with them for my patients that I knew were struggling. Either they were just trying to hold on to what teeth they had because they knew they didn't want dentures, or they had dentures and they were miserable with it. So even when I discovered the mini implants as a dentist, it was eye-opening for me as well. So you're not the only one, and I see people every day, that have, seen us on TV, and they give us a call, and we're able to give them another option and a better option, and sometimes a lot more affordable option. Or they were not a candidate for implants before, and now they can be a candidate for the mini dental implants. They couldn't afford the surgical big implants. They can afford the mini implants. So there's just numerous ways we can help people with the mini dental implants.
All right, if you have a question, if you're wondering if you're a candidate, you or a loved one, 571-5263. Dr. Ackerman will field all calls. Now, you touched upon something that I think is interesting. Okay, the advantages of. First of all, we all have a budget. You were saying it's significantly less expensive than the old method, correct?
Yes, I would say, and actually this week was perfect example. I saw, several patients had come in with big treatment plans for the surgical implants, and we were able to give them a treatment plan for at least a third to half the cost and make it something affordable, where they could have an option of not just having a regular denture. But yeah, affordability definitely kind of number one thing. The mini implants are a lot less invasive. I don't have to do any incisions or stitches. They heal up quicker.
You don't need any of that.
So yeah, I don't have to do bone grafts or sinus lifts. I know we'll show the models and everything later, but I always say I don't need a ton of bone, I just need a little bone, and we'll show the model later, kind of the comparison. So I'm able to just help people out that weren't a candidate before or had to go through some major surgery and major expenses before.
Luckily, medical technology is amazing, and it has evolved. So people who think, I don't want to go through all that surgery and seeing different doctors, it is so simple now that it's amazing. And at first it was hard for me to believe, Dr. Ackerman, because I saw these positives. I'm going, okay, there's got to be a pushback here. I'm a little jaded. I want to make sure, but it is all good. The news is all good, and to show you I love the proof is in the pudding. Whenever you show a client on, a patient who's come on, before and after, so you're going to introduce us to, is it Angela?
It's Angela, yes. Probably one of my favorite patients. She has just the best personality. You know those people you meet and their personality is just contagious. You could be having the worst day. Angela comes in and just makes you smile. And so she came in, and as you can see, she had did everything possible to try to save her existing teeth. Her teeth failed her. Angela did not fail her teeth. She went through gum surgeries, deep cleanings, you name it, did everything she could. But as you can see, she had a lot of bone loss and periodontal disease, and her teeth were all getting loose, and she needed to have them all removed, and she knew that. So we were able to do the snap-in denture for her and just get her smile back. And she was just so ecstatic once we were able to get her smile back right there. Yeah, so
I mean, beautiful woman.
Yes, and she just deserves it because she's just a happy, positive person. And like I said, she did everything to try to save her teeth. So, like so many people, you know, they feel ashamed or embarrassed, and they shouldn't, because a lot of people, it can be genetics, and they've done everything. You know, she did gum surgeries and deep cleanings, and like I said, her teeth just failed her. She didn't fail her teeth, but she found me, and we were able to do the snap-in denture, so she does not have to have a regular denture, no glue. Her dentures stay in. She can eat better. You know, it doesn't gag her because we're able to trim it back some, and she's just, you know, ecstatic, and she can share that smile with everyone, and everyone deserves to see her smile because she's just a wonderful person.
Wow. 571-5263 if you have a question. Now, you mentioned the procedure with the snap-in dentures that Angela decided to go with that option. You have two options. So we'll get to the models a little bit later, but the quick overview is, one, is you can tighten up someone's existing dentures, right? You can make sure that they snap in, no more glue, right?
No more glue. They stay in better. You know, you can bite into that cheeseburger. You can eat that piece of steak. You can eat those peanuts and pretzels and all those good things that, you know, patients are always asking me, can I do this? Can I do that? So with the snap-in denture, you know, it just keeps that denture in nice and tight, and it's so much more comfortable. You don't have to use the glue. And then the other option is the permanent teeth, where it's more like having your third set of
There's no plastic at all.
Right, no plastic, nothing covering the roof of your mouth. You just lose the bulkiness of a denture. And those teeth are permanent, so they're cemented in. They don't ever come out. You know, with the snap-in denture, you can't snap it out once a day to rinse and clean it. The permanent teeth are just closer to having your natural teeth. And it's definitely the nicest thing we do, the permanent teeth, because you can definitely taste your food better. Everything is just nicer with the permanent teeth.
And if you're wondering, you're saying, okay, is that less invasive as well? It is. It's really just numbing of the gums. There's no bleeding. There's no follow-up surgeries and all of that mess that you had to go through before. It's very simple. How many office visits are we talking before you have a finished product?
So it all just depends. Like if you come to me and you've already had your teeth taken out and you're healed up, you know, we're talking about one visit, take impressions, one maybe for a try-in, and third visit we're putting implants in, and you are walking out with dentures snapped in or permanent teeth.
All right, coming up here, we're going to show those models that we talked about and talk about how simple. Believe me, there's no downside here. And if you have a question, 571-5263, we realize that everyone's a little bit different, so Dr. Ackerman would love to talk to you. Welcome in Freedom, mini dental implants changing lives like Angela's for the better. We'll be right back.
This morning, you may be planning to leave the house.
Parents with a lot of thoughts on this one.
How to handle things moving forward as we start a new school year.
This morning, you might be heading back to work.
And traffic so far seems to be flowing with ease.
This morning, you got the local news and weather you needed to start your day on Wave 3 News Sunrise.
It's really heating up out there this week. We're talking about temperatures into the upper 90s potentially. I'm tracking a hot July forecast this week on Sunrise.
Attention, Boy Scouts of America's sex abuse victims. The Boy Scouts just filed for bankruptcy, which reportedly will create a $1 billion fund to compensate victims of abuse that investigations show the Boy Scouts spent decades covering up. If you or someone you know was a victim of sexual abuse at the Boy Scouts, file your claim now before it's too late. Call 800-800-4600. Hughes & Coleman has helped thousands of victims and will help you too. Call 800-800-4600 right now.
Dr. Regan Ackerman is my guest, Freedom Mini Dental Implants. And if you have a question, if you're wondering, am I a candidate for this procedure? Because I'm going to save money, it's less invasive, and your smile's going to look absolutely fabulous. You may be. In fact, Dr. Ackerman, before you show us those models, it is rare that you tell a client they're not a candidate, right?
It is pretty rare. I'd say less than 5% of people, you know, when you come in, that's another good thing to mention. When you come in, the consult is free of charge. All you have to do is call the office for a free consult, and I'll take a free 3D x-ray to show me how much bone you have. So it's pretty rare that I have to tell somebody they don't have enough bone to be a candidate for the mini implants. That's why I take that 3D x-ray. It tells me right there, that first appointment when you come in for their free consultation. But yeah, I don't have to have as much bone with the mini dental implants because they're just a much smaller diameter implant. So I'd say 5% or less that I have to say I cannot place an implant for you.
It's exciting. The technology is very exciting. I'm excited for you to see and eager for you to see the models that we're going to show you. Before we do, though, let's grab a phone call real quickly. I've asked for calls. You've been nice enough to do so. Vera, welcome into the show. Thank you for calling. Hello.
Hello.
Yes, go ahead, Vera. You have a question? Hi.
Yes, I'd like to know if the implants are covered by Medicare.
So, good question. Usually, I'll be honest with you, insurance doesn't cover a whole lot of the implants. We do offer several financing plans because, insurance doesn't cover a lot of the implants. And once again, when you come in for that free consultation or give our office a call, we can go over how the financing plans work. A lot of times they can go up to 2 years with no interest and help you out that way.
Yeah, and I want to, again, repeat the fact that the old procedure is at least a third to a half more. Depending on the case, and I know everyone's a little bit different, so we can't, it's hard to narrow down until you meet with someone and have a consultation. All right, let's talk about the models here. First of all, let's talk about Angela's procedure, the snap-in dentures, and how that works, and then we'll talk about the permanent teeth.
Yeah, so I'll show this model here. I don't know if they can zoom in for me. So this is what we call the snap-in denture. So when I place these implants, just as he was mentioning, I don't make any incisions or stitches, just a little numbing local anesthetic, and then just kind of make a tiny little hole, and then the implants are placed. They're just little titanium screws, and the same day I put the implants in, I will put these attachments inside your denture, and you will leave the same day with your denture snapped on to those implants. So then it is nice and tight and secure. You don't have to use denture glue anymore. A lot of times too, we can kind of trim it back. So if you're gagging from your denture, it solves that problem as well. But this is just a lot less invasive because, like I said, no incisions, no stitches. When you leave, you're not swelling or bleeding. And the same day I put the implants in, you will leave with your denture snapped onto the implants and get rid of all that glue. I've even had a patient tell me, just even with the snap-in denture, they were able to taste their food so much better because they didn't have all that glue in their mouth. So this snap-in denture is an amazing option for people struggling with keeping their dentures in.
I don't want to mention the manufacturers of the glue, but they don't like you very much. Because
no, we get out of that, yeah.
It's going away.
Yeah.
Okay, now the permanent teeth. Now, I love this procedure, and you've had quite a few before and after pictures here. There is no plastic. It's just like you said, your third set of teeth.
Yes, yeah, so this is definitely one of the nicest things we do for patients. We're going to place the implants exactly the same way. We're just going to put more implants in to stabilize it. But same thing, no incisions, no stitches, just a little local anesthetic.
No plastic.
Numb up the gums. And then we are able to make this bridge of teeth. So like you can see, a lot less bulky than a denture. And then these teeth get cemented, kind of glued permanently onto those implants. So this does not come in and out. It stays in, you get to chew and eat, brush them like you normally brush teeth, and then we give you a water pick, a little water flosser to kind of help keep the edge clean. But then, as you can see, you have nothing on the roof of your mouth. You can really taste your food again. For those people that say, a denture affects their speech, this solves that problem as well because you no longer have anything on the roof of your mouth and, can speak, clearly sing, play an instrument, all those things that a denture may have hindered for you. So these permanent teeth are a fantastic option. Like we said, it's like having your third set of teeth back.
And believe me, you're going to save some money as well. 571-5263 if you have a question. You know, we talked about foods that we love, Dr. Ackerman, but also let's talk about a lot of those foods are very nutritious, and you could feel much better if you can eat like things like steak, you know, which has iron, it's hard to get. You know, crunchy vegetables, fruits, things that you probably avoided if you had that denture glue or ill-fitting dentures. You can now eat foods that are nutritionally dense.
For sure. No more soft food diet. You know, kind of a joke at the office is when patients come back, they're 20 pounds heavier because they're able to eat again. But they appreciate that, and they like being able to eat their steak again. And like you said, the peanuts and the pretzels. I've had a patient, even she was like, I finally got to bite into a cracker again, and just to hear the sound of that, and just the things that we may take advantage, you know, for every day that people with dentures struggle with.
So I'm playing devil's advocate here because I'm looking for any kind of negative, and there really isn't. But I have to ask you, so are these as durable as the old surgical method? Or do they last as long? Tell me about that.
Yes, certainly. As you know, Dr. Stroud used to be here, and he retired, and I see his patients every day, and they've had their implants in for 10, 15 years. They definitely last. They're made out of the same titanium as the surgical implants. There's been plenty of research to prove that, you know, they last and are just as sturdy as the surgical implants.
So when those clients do come in, or when someone like Angela, who's a new client, and they have this life transformation, not just because of their smile, but the confidence and the compliments they get from their friends.
Yes.
So you look, Angela looks like she's the kind of person who deserves to be able to smile, because you can tell she has a lot of joy in her heart. So when do you get this a lot? Do you get, I wish I'd have done this earlier?
Yes. Definitely get that a lot, or I wish I had called your office sooner. Like I said, it's just a free consultation. It doesn't hurt to call and set up the appointment, see what your options are, see what the cost will be, and, you know, change your life as well. Don't, you know, it's not fun sitting there and struggling with the denture.
No. So don't do that. And now the free consultation before we go to break. And again, if you have any questions, 571-5263, the free consultation. How does it exactly work? You just make sure they're a candidate. Can you start talking about payment options? I mean, how in-depth can you go?
Yeah, so that first appointment, we go over, we take the 3D, the x-ray, and then I'm able to give them all their treatment options and go over costs that day with them, and go over, you know, the financing plans if they want to look into the financing plans. So that day, and sometimes, you know, if we have a patient that, you know, you want it and you're ready, and we may even take impressions that day and go ahead and get you started. So it's just, you know, a matter of making a phone call and coming to the office.
It has to be rewarding for you, Dr. Ackerman. I mean, when you see people like Angela, you change their lives for the better, and they feel so much better about themselves. It's bigger than a smile, isn't it?
It is. It just reminds me every day why I went into dentistry. You know, it's very rewarding.
All righty. So the phone lines are now open. We're usually packed here, but 571-5263 if you'd like to talk to Dr. Regan Ackerman and find out if you're a candidate. We'll take a little break. Coming up a little bit later, too, Holiday World tickets. Would you like to call off at Holiday World? We'll have free tickets coming up. Not yet. Hang in there with us on Wave 3 Listens.
When you're injured, the insurance company hopes you'll hire the wrong law firm. You're smarter than that. You deserve better. There's only one Morgan & Morgan for the people.
Is it time to say goodbye to your outdated and ugly shower or tub? Experience luxury and comfort in your new bath from Green Star Home. Locally owned and operated, Green Star Home specializes in tub or shower remodels. They do it better and can complete most projects in as little as one day. Green Star's factory-trained technicians, exclusive technology, and thousands of designs will bring beauty back to your bath. Call now through Wednesday for $2,000 off your new bath or shower conversion.
Green Star Home, helping you relax in luxury.
People are always asking me about Tara.
I think you're spending too much time on social media. Do you have to comment on everything?
Yes, I do. And it's about time you put me in a commercial. Go to getthetiger.com.
More local news and weather that matters to you on the new Wave 3 News at 4.
Freedom Mini Dental Implants, that's Dr. Regan Ackerman. And Dr. Ackerman, we've talked a lot about denture wears, and certainly that's a good portion of your business. But there are also some folks who may have a single tooth, maybe a bridge, and they're not happy with their smile either. You can help those folks as well, right?
Definitely. So many people have lost a front tooth, trauma, they were a child, or a baseball injury, softball injury. A lot of people have been struggling and wearing, if you've had to wear one of these, you know what it is. It's called a flipper. It's like a partial that comes in and out, and it is not fun to wear either. So I'm able to get people out of those and give them just a single tooth with the mini implant where the tooth is cemented on. It stays in. You no longer have to wear that partial. Same thing, a lot of people have missed their back molars, which I call your big chewers, and they struggle with chewing. They have their front teeth, but it's still very hard to chew when you don't have your back teeth. So I replace a lot of molars in the back and give people, more to chew with. So that's definitely an option, and I can certainly show that model as well.
Yeah, let's take a look at those models. Okay, yeah. And also, that one model that shows you the advancements that's been made and how small this hole is that you need, and that's why there's really very, very few who are not candidates, because you don't need much bone, right?
Right, yeah. So I'll start with that since you just mentioned it. So this model shows you how minimally invasive, how less invasive the mini implant is. So the small hole, that is the hole that I make when I place an implant, versus the surgical method, a much bigger hole. They're making an incision, you got to heal up a lot longer, and as you can see, they have to have a lot more bone for this surgical implant. Whereas with the mini implant, like I said, I don't have to have a lot of bone, I just have to have some bone.
And there's no surgery, right? It's just numbing of the gums.
No surgery, just numbing of the gums, no incisions, stitches, and since this hole is so much smaller, I don't have to do bone grafts or sinus lifts or any of those other procedures that they may have had to do to be able to place a surgical implant. So that's a good example of just how less invasive these mini implants are.
All right.
So
and then the model with a single tooth, and then we're going to grab some phone calls here, if you don't mind.
So
this is interesting.
Let's see, we'll start with the front tooth here, because I see that a lot. Or a lot of people are born missing a permanent tooth here. So same concept, going to place this mini implant, no incisions, just going to numb up the gum, okay? And then we're able to make your nice pretty tooth, and this cements on to the implant. Now is cemented onto that implant and permanently in your mouth. So then, a lot of people that have been wearing a partial, they know it covers the roof of their mouth, and it flops around, and it's hard to eat with. So you can replace just a single tooth, and then kind of, as I was referring, even if you're just missing several back teeth, we can replace 2 or 3 teeth at the same time with the mini implants. Same thing, we'll place those implants and have the teeth made, and they cement and stay in permanently. They do not come in and out, and you able to chew again and get rid of that partial, or fill out your smile again. So it's a fantastic option.
All right, we've got lots of calls lined up here. Let's go to Debbie, who was first. Debbie, welcome into Wave 3 Listens.
Hello.
Hello, Debbie. You have a question?
Yes, I do. I have burning mouth syndrome. I don't know if you've ever heard of that.
I have, yes.
And I have dentures in the top and the bottom, and with that plate in the top of my mouth, just having this burning mouth syndrome, plus I have to put the glue in, it about drives me insane. It makes me sick, and I can't even wear them.
Right.
So when you get those implants, is that top part that's in the top of your mouth gone?
Yes. So majority of the times, with the snap-in denture, we can trim that out. And then obviously if you do the permanent teeth, that definitely, all that goes away. And that would definitely be the best option, because then you wouldn't have a denture rubbing on your gums at all. But even when we do the snap-in denture, we can trim out the roof of the mouth. And like I said, especially it gets you not using all that denture glue, which could be a trigger for that burning mouth syndrome as well. So yeah, good question.
Thank you for the call, Debbie. Let's grab another one and talk to Ruth. Ruth, welcome in. You have Dr. Regan Ackerman.
Thank you.
Hi.
I have a question about the lower dentures.
Uh-huh.
I have had my teeth done for over 30 years, and now I don't have the bridge rub tooth anything on. I mean, it's wrong down almost the level. So, is there anything that I could get the smoking dentures?
Ruth, I'm going to be honest, I'm having a hard time hearing you through the phone system, but I think what I got is that you've either had a lower denture for a while, and maybe curious if you'd be a candidate for the snap-in denture. Is that correct?
Okay, the lower gum is, the lower bridge is gone.
The lower bridge
is gone. Yeah. What I would advise, is just setting up a consult so I can take a look and see, what you're talking about, and take that 3D X-ray, which is no charge, to see if you're a candidate. If you have existing lower teeth that are failing you, so to speak, then yes, there's still options where you can, be a candidate for the snap-in denture once those teeth are removed, and you'll never not be without teeth. We'll discuss that when you come in for the consult.
All right, I think we've got time for a quick call here. Cassidy, you have a question for Dr. Ackerman?
Yes. I've had my top teeth gone for a while, and I just had my bottom teeth removed, and my gums at the top have shrunk a lot.
Right.
I didn't know if I would still be eligible.
Yeah, so that happens a lot. I see it a lot. Someone's had a denture for several years, and like you said, your gums and your bone do kind of shrink and resorb, and that denture gets really loose. So chances are you're probably still a candidate for the implants. Like I said, I'll take that 3D X-ray and confirm it. We would probably make a new denture or bridge, just depending on what option you went, and that new denture would fit better with your gums, because it would be based on how your gums are now. So definitely could still be a candidate. Please call and set up a consult.
Yeah, we're going to recommend to everyone, when you come out of quarantine, you're going to come out with this beautiful smile, thanks to Freedom Mini Dental Implants and Dr. Regan Ackerman. So give the office a call today. The consultation is absolutely free. We'll take a little break, and coming up, get ready. We're going to give away Holiday World tickets, and we're going to remind you about that number. Don't wait any longer. Make a difference in your life. Be proud of your smile. We'll be right back.
Hey, remember, you can shop our safe, sanitized showroom now on Dixie Highway. Toyota of Louisville, Tim Jones back with an update. Get $1,500 customer cash on a brand new Toyota 4Runner. Toyota of Louisville, a Swope dealership where nobody walks away.
A message from attorney Mike Sullivan.
If you are like so many of the good people I've talked to over the years, you probably have bad health. You know somebody who's drawing benefits, yet they're not near as bad off as you. It doesn't feel fair at all, and it's not. And this is exactly why you need an experienced lawyer to fight this with you. For me, it's not a new fight. But for you, it's all about protecting your future.
Call 888-587-0228. Call now.
Great deals, great selection at Toyota of Louisville. And remember, we'll buy your used car. And if you've had past credit problems, we can help you with second chance finance. Dixie Highway at ToyotaofLouisville.com, a Swope dealership where nobody walks away.
Holiday World and Splash and Safari, the world's first launched water coaster right there. It's called the Cheetah. You can enjoy it for free if you're the third caller at 888-800-9283. Holiday World and Splash and Safari. All right, Dr. Ackerman, want to remind everyone, today's the day. Make a difference. Smile like Dr. Ackerman. I love your smile. If you would, tell them. Free consultation, right? Free consultation, free 3D X-ray. Please call and let me give you more confidence in your smile and get you chewing again. There you go. Get you chewing again. I like that. Once again, it's Freedom Mini Dental Implants. We want to thank them for coming on the show. Thank you for watching. Thanks for all the questions. And hopefully you have a great day. Stay cool, and we'll see you tomorrow right here for the Thursday edition of Wave 3 Listens Live.
Stay informed about